this, let's go back to the right leg. We're gonna go back to the right leg, kind of anchored on in. And anchor-wise, we can go just kind of a straight, kind of lateral anchor for either the hip joint itself. So when I go up high on the right hip joint capsule here, I'm getting more of a lateral distraction, which is creating space by pulling the femur away from kind of that acetabular fossa, that pelvis right there, creating space to get extension, to get the internal rotation, that abduction, that inferior and that medial kind of mobility, as well as that anterior and posterior hip capsule mobility. I'm still going to use my forward lunge for these progressions right here. I'll typically go maybe a foot or two forward of where my anchor is. So a foot or two forward from where my anchor is. I'm going to go with that lateral kind of distraction first, and I can feel that pretty good. So what I'll use the inferior anchor for in a second, then going down to the knee, is not so much of that distraction because I've taken away distally from that hip joint, but going down to the knee forces more abduction into that side-to-side plane to help kind of drive and facilitate kind of some more motion. And with patients, a lot of times getting more extension, usually that side-to-side translation is usually kind of the big driver in terms of getting more extension. So what I'll do now, left arm is going to reach overhead as I'm driving my hips forward and on an angle to the left. Right foot is pointed forward, and then I'm going to add some rotation to get some more internal rotation right here. And this is a position where a lot of times when I'm driving in sync, I'll find that patients have a really difficult time getting and facilitating that internal rotation due to, again, pelvis slamming anteriorly forward and basically cutting off all that motion. And so that's why driving and facilitating upper extremity has been a successful thing for me. So I'm going to show you right now. So if I want to get a little more extension, so I'm going to drive hips to the left on maybe like a 45-degree angle. Left arm is going to reach overhead. I can use this with a dowel as well. So here and here. What if I kind of preset some rotation, drive on a 45-degree angle to the left, and now I go after some side bend to the right. Side bend to the right. Let's go ahead, and of course we can sequence and combine the rotation and the side bend. I want to take you to the anchor right above the knee. This is going to be a little more aggressive. So what I want you to do, forward and backwards. Let's go. Let's go on the dowel. First of all, find your sweet spot. You're going to drive your knee forward. You're going to drive it arms overhead. And I can really feel that anterior, inferior, and medial, that inside bottom and front hip joint capsule really getting stretched right now. And then we can add some rotation. Still translating the pelvis on that 45-degree angle. And now let's combine them. I'm going to set the dowel down for the combination. Forward and backwards. Right arm is rotating right, left arm is reaching overhead, both in sync to drive the internal rotation, abduction, and extension. And my hip joint capsule right now is wowzers, is loving this stretch. Let's go ahead and switch legs. So I showed you my posterior anchor. We talked about how superior to inferior, how the extension portion of that, the intensity increases the further down I go. We talked about the lateral anchor and how the higher I go, I'm going after this hip joint capsule distraction Whereas on the bottom, I'm driving kind of that frontal plane motion of the femur more to get more abduction, to go after anterior, inferior, and medial hip joint capsule. And now we're going to go anterior lateral with it. So, or excuse me, a posterior lateral anchor. We're still going to go high up, kind of right around kind of the upper part of the groin. So instead of facing forward and instead of facing straight on, anywhere from 45 to 30 degree angle right here is where we're going to kind of position ourselves. And we're going to go ahead and we're going to do that same stuff right here. And so I like the posterior lateral anchor. It's kind of a toss-up in terms of which one is my favorite. I like this because I get a little bit of kind of both worlds in terms of the hip distraction yet, kind of getting yanked away from the pelvis, but then that good superior and inferior kind of mobility driver of where it's positioned right here. And so what I'm going to have you do, right leg forward and left leg back, you'll go ahead and you'll do the same things in terms of, here if I want to use my dowel and I've progressed to that and not having to use that for support, I can do that. We're going to go frontal plane as well. We're going to go frontal plane. We're going to go transverse, so we're just getting our three kind of basic planes in right there. And then you know what? Maybe I want to combine them. Let's preset the transverse plane. So I've rotated to the left and I've set my dowel, reaching overhead to the right. And then, boom. Rotating left in sync with my left arm. Rotating right in the frontal plane in sync. And now if I want to add kind of sagittal, I can get some extension with the left arm, and my right arm can drive in sync with the right. And I can do the same thing in terms of sagittal and frontal. So left arm's reaching overhead, right arm is side bending overhead and to the left. To kind of tweak things a little bit more, we're going to use a block of wood. And we're going to go back to original position. I want to go just above the knee though, as kind of my anchor point. Right above the knee and the left foot. So we need to resort back to and reference back to our intro conversation on the hip joint capsule. Right foot right here is back, toes pointed forward. So I can feel that I'm getting more translation of the pelvis forward because I brought the ground up through my left lower extremity. I am getting that good kind of posterior rotation with my right arm reaching overhead. Good posterior rotation so that I can get this good kind of side to side translation of the pelvis. And let's go ahead and start combining these a little bit. So what happens, TZ1, foot and ankle and hip, are going to determine how successful we are over on the right. We manipulate the left side right here. And so let's add a little rotation and a little side bend for the heck of it, because I think that you get my drift in terms of what we're trying to do. So rotation, transverse and frontal plane. Let's add a little kind of sagittal plane with the right arm. Left arm rotates and reaches to the right. I want you to go ahead and play with these guys. Next episode, we're going through anterior lateral kind of positioning to facilitate this translation kind of side to side to open up the hips. Play around with these. Your hip joint capsules will scream with delight.